Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Diabetic Kidney Problems. Introduction. Patients with diabetes are more likely than other people to have kidney problems. If left untreated, these problems can be life-threatening. Many diabetic kidney problems can be prevented or delayed through good diabetes management. When they happen, early treatment is important. This program explains how diabetes affects the kidneys and what diabetic patients can do to prevent these kidney problems from happening. The kidneys. The kidneys are organs located in the middle to lower back on both sides of the spine. We have two kidneys. Urine is formed in the kidneys. It then flows through tubes called ureters to be stored in the bladder. When the bladder is full, a person feels the urge to urinate. Urine is emptied through the urethra. The main purpose of the kidneys is to make urine by filtering harmful chemicals called toxins out of the blood. The kidneys also help keep necessary chemical substances in the blood, such as salt, proteins, and sugars. The kidneys control the amount of fluid we keep in our bodies. For example, when we drink more fluids than we need, the kidneys secrete extra urine. On the other hand, when we do not drink as much fluid as we need, the kidneys make less urine. The kidneys also help control hormones that strengthen our bones and produce red blood cells. Since the kidneys constantly filter the blood, they are very sensitive to anything we eat or drink and to any medications we take. The kidneys also help to keep our blood pressure regular. This is why many kidney diseases result in high blood pressure. Damage to only one kidney is not usually a major problem, since the other kidney can take over for it. However, if both kidneys become damaged, a person will die within a few days if they do not get dialysis. Diabetic kidney problems. If you have diabetes, your blood sugar levels are too high. Over time, this can damage your kidneys. Kidney damage from diabetes is called diabetic nephropathy. Diabetes weakens the body's blood vessels. The blood vessels of the kidneys are small and can be easily damaged. Damage to the blood vessels in the kidneys means your body cannot properly clean and filter your blood. Toxins build up in the blood, and substances that are needed by the body may be released through urine. The body will also retain more water and salt. This can cause weight gain and swelling in the legs, ankles, and feet. If left untreated, diabetic nephropathy may develop into kidney failure. Kidney failure happens when both kidneys are no longer able to function. Kidney failure can be life-threatening. Without proper kidney function, the body cannot remove toxins from the blood. High levels of toxins can lead to death. Similarly, kidney failure may cause high levels of potassium in the body. The kidneys normally remove potassium from the blood. Having too much potassium in the body can lead to death. Kidney failure can be avoided or delayed through prevention and treatment. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Symptoms of kidney problems usually do not appear until the kidneys have almost stopped working. Swelling of different body parts is one of the earliest signs of kidney disease. When the kidneys are not working right, the body retains water. This leads to swelling in the face, ankles, legs, and throughout the body. The extra fluid can cause shortness of breath. Since toxins build up in the body when the kidneys are unable to filter them out, patients with kidney failure feel very tired and weak. They have no stamina or energy. This is partly due to the body not producing enough red blood cells, a condition called anemia. Kidney failure patients sometimes feel pain below the rib cage. As kidney failure gets worse, blood pressure tends to rise and the body makes less urine. Diabetic patients may also find that they have less of a need for their insulin or other diabetic medications. With time, kidney failure can also cause itching, leg cramps, nausea and vomiting, pale skin. Diagnosis. Kidney damage begins long before symptoms appear. If you have diabetes, your healthcare provider may regularly test you for kidney damage. A sample of your urine can be tested to check for kidney damage. The sample is tested to see if it contains a protein called microalbumin. Microalbumin in the urine is a sign of diabetic kidney disease. Blood tests can also tell your healthcare provider how well your kidneys are working. Regular testing is important because diabetic kidney damage happens slowly. Symptoms often do not appear until the kidneys have almost stopped working. Early treatment can also prevent or delay kidney failure. Prevention. It is better to prevent kidney failure in diabetic patients than to treat it. Good control of blood sugar and blood pressure, healthy eating and exercising can prevent or delay kidney damage caused by diabetes. It is also important to give up smoking. Regular checkups with your healthcare provider are essential. Your healthcare provider may recommend tests to check your kidney function and look for possible damage. Your healthcare provider may also recommend a special diet. Some dietary restrictions slow down and possibly stop kidney damage. Some of these restrictions include eating less salt, also called NaCl or sodium, potassium, also called KCl, proteins. Medications are also available to reduce damage to blood vessels in the kidneys. The damage is reduced by lowering blood pressure. Medications commonly used to reduce blood pressure include angiotensin II receptor blockers or ARBs, angiotensin-converting enzymes, better known as ACE inhibitors. There are also medications available to treat diabetes and high blood sugar levels. Always take your medication as instructed by your healthcare provider or pharmacist. Treatment of kidney failure. If diabetic nephropathy has progressed to kidney failure, the main treatment is dialysis. Dialysis is a process that replaces the function of the kidneys using a machine or a special solution. There are two types of dialysis: hemodialysis and peritoneal dialysis. Each works differently to filter toxins out of the blood as the kidneys normally do. Hemodialysis reroutes the blood to a dialysis machine. The machine cleans toxins from the blood and regulates the levels of essential chemicals such as potassium. Peritoneal dialysis uses the peritoneum, which is the lining of the abdominal cavity, to clean the blood. A tube, also known as a catheter, is surgically placed in the peritoneal cavity. A solution called dialysate is allowed to flow into the peritoneal cavity through the catheter. The dialysate solution interacts with the blood through the peritoneum, filtering out toxins and cleaning it over a period of several hours. The fluid is then drained to the outside of the body into a special bag. The cycle is repeated. For dialysis to be successful, patients have to follow strict dietary restrictions. Talk to your healthcare provider to learn more about these restrictions. A kidney transplant can cure some cases of kidney failure. Unfortunately, there are not enough kidneys available for all kidney failure patients. It is also not the best option for some patients. This is why it is important to try to prevent or delay diabetic kidney damage.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The kidneys are extremely important organs that filter harmful substances out of the body. Patients with diabetes are more likely than other people to have kidney problems. If left untreated, these problems can be life-threatening. Many diabetic kidney problems can be prevented or delayed through good diabetes management. Management of diabetes includes controlling blood sugar levels, eating healthy, eating less salt, less potassium, and fewer proteins, exercising, keeping good hygiene, learning about diabetes. When discovered early, diabetic kidney problems are easier to treat. If you have diabetes, make sure to get tested frequently for kidney problems. Thank you for using Explain.